Hi, everybody. My name is Rachel. I am a Skill Up Life Coach here at the Excel Center in St. Louis, Missouri. Today, I have here with me Katie from KLR. She trains for two different career paths. One is pharmacy technician, the other is medical billing and coding. And I'm here with her today to pick her brain and get some more information about those career fields and what her training is like. So, Katie, welcome. Good morning.
Thank you. Thank you. Good morning.
So I'm just going to kind of jump in. I know you do pharmacy tech and medical billing and coding, and I know the medical billing and coding is going to be a little bit of a newer thing for you, but I'm going to start with pharmacy tech if that's okay. But before we do that, I was just wondering if you could kind of just let our viewers know a little bit about your background and especially your educational history and what led you to opening KLR.
Yes. So my name is Katie Riegelsberger. I am the CEO and instructor for KLR Pharmacy Technician Training School and KLR Certified Billing and Coding Specialist School. I actually have quite a long background in history, and that started with parents who were both drug addicts and alcoholics. I found myself pregnant with my first child when I was 13, and my parents unenrolled me from school at the end of 8th grade, saying that they were going to homeschool me, which was not the case. So I studied for my GED and took my GED when I turned 16, and I thought that was going to be something great for my future, but I continued to work dead-end jobs with no benefits, no PTO, really not being able to make ends meet. When I was 19, I gave birth to my second child. Fast forward a few years after that, I was taking my kids to a martial arts lesson and heard someone talking about the Excel Center, which is a high school for adults, as you all know. I jumped right into the conversation and I was enrolled the next day. I had 0 high school credits, never been to a day of high school in my life. I spent 8 months at the Excel Center in Anderson, Indiana. I earned 42 credits and 2 certifications, including the pharmacy technician certification. A week after graduation, I was offered a position at CVS Pharmacy, where I worked my way up to lead technician and inventory specialist while I put my resume into every hospital under the sun. In December of 2014, I was offered a position as an inpatient pharmacy technician at Riverview Health in Noblesville, Indiana. And from there, I did all the basic training, chemo training, IV training, med history training. I was a member of the hazmat team, which served all of Hamilton County. And I headed up the internship program for a high school, a local high school. In 2016, I was offered the position of pharmacy supervisor, where I was in charge of 30 plus technicians in 8 different positions. And I absolutely loved my time at the hospital. But in 2018, the Excel Center contacted me and asked me if I would like to teach a pharmacy technician certification course. And we started that course out with, we actually started out in person with just 1 or 2 schools. And then that just continued to grow. Once COVID hit, they asked me if I would be able to teach the course online. So we tried that out and it worked actually way better. Our scores were better, our attendance records were better, our participation with students was better. And so throughout the last several years, we have kept it that way. So that is my education and my background, and KLR is now teaching for 9 different states with the 2 different courses, and we are also open to the public.
That is awesome. What a great story of perseverance, by the way. Thank you for sharing that. So like I said, we've got pharm tech, we've got medical billing and coding. So I just wanted you to briefly kind of explain, what does a pharmacy technician do?
Right. So a pharmacy technician, your main role as a pharmacy technician is that you are assisting the pharmacist. You're either generally you're going to be in a retail setting like CVS, Walgreens, Walmart, Sam's Club, Costco, Kroger, or you're going to be in a hospital setting. And hospital settings have both retail and inpatient settings. That inpatient is where you're going to be taking care of patients who are admitted to the hospital. So your customers are a little different. We have a blog post about this, but we just did it actually yesterday. Your customers are a little bit different in the inpatient pharmacy hospital setting because you are speaking more with the doctors and the nurses and things like that. In a retail setting, you are working with patients who come in to get their prescriptions, just like you or I go to CVS and pick up our prescriptions, right? So retail pharmacy technicians are pouring and counting medications, answering phones, working with insurance companies, checking patients out through the cash register, working the drive-through window, filling supplies needed throughout the pharmacy, stocking the shelves that are outside of the pharmacy for over-the-counter medications. When you're in an inpatient setting, a pharmacy technician is, again, answering phones, but talking more to doctors and nurses, making chemotherapy and IV medications, repackaging medications, compounding medications, filling unit dose medication machines like Omnicells and Pyxis, completing med histories for patients who are admitted to the hospital or are coming in through the emergency room. So in either situation, it can change up pretty drastically, but the good side of it is that you really never have a day that's exactly the same, and you're always pretty much busy and learning.
So, and this kind of follows up well with what we just talked about, with you giving some of the descriptions of the job task. We can probably guess some of this, but I wanted to know what you thought were some great skills or personality traits that would make somebody a very successful pharmacy technician. For example, an accountant is somebody, they're going to have to love math, right? And love numbers. They're going to have to be detail oriented, maybe be able to communicate well when there's problems. What do you think are some of the personality or traits or skill sets that somebody would kind of need as a basis to be a great pharmacy technician and enjoy that job?
So I would say that there are definitely several. I would say attention to detail is going to be one of the largest, right? You are working with patients who are sick. You are working with medications that could potentially harm a person if you're not careful. So attention to detail, responsibility, and honesty, right? You're working underneath that pharmacist, and that pharmacist is busy. She does not have time to stand over your shoulder. No pharmacy technician is being micromanaged. They have to be able to trust you, and you have to be able to make the correct decision and be honest if you make a mistake. Communication. Any person in a pharmacy is working with a large group of people, whether that be the people in the pharmacy, the people in the insurance company, the people throughout the rest of the hospital, and the other departments that you're working with, because they all go hand in hand. So communication is going to be huge. Empathy and compassion for your patients is really, really important. Time management skills are important. You're going to be busy. You need to know, you have to realize how to prioritize your day. Sometimes if there are 400 things going on, you have to be able to say, this one needs done right now. This is what I need to do. And then after that, I can jump on this one. So I think that those are probably some of the bigger ones that I would point out for pharmacy technician.
Okay, so you did a great job explaining what the job is like, maybe some of the skill sets that somebody might want to have to be successful. But a lot of times people don't think about the physical demands of a job. Can you speak a little bit more to what physical demands there might be as a pharmacy technician day in and day out?
So for a pharmacy technician, I don't really feel like there's not a lot of you're not going to get a lot of lifting. You don't need to be, I wouldn't be a pharmacy technician if I had to lift 50-pound boxes every day. I wouldn't be able to do that. But there's a lot of standing, especially in retail, a lot of standing, and in a hospital pharmacy, there is a ton of walking. So that would be like the main one that I would say. The other one would be a sleep schedule. That can sometimes get to you. So a lot of pharmacies are going to have those turnaround shifts where you work until 11 o'clock and the next day you need to be there at 6 o'clock in the morning. So that can really kind of wreak havoc on a person's sleep schedule. And it is something that we all adjust to. And not all pharmacies are like that. You can find ones that are basic normal hours every day and they stay that way all the time. But in a lot of settings, you're going to have at least a couple of turnaround shifts a month.
That kind of goes with the next question. I wanted to ask more about the hours. So it sounds like it kind of just depends on where you work. And would you say that working in a hospital has more of those turnaround shifts or those longer hours? Or again, does it just depend on the particular hospital you're at?
It really kind of depends. So there are retail pharmacies who have 12-hour shifts. I have not come across a whole lot of those for a pharmacy technician specifically. Those are generally for pharmacists. But those shifts that you're going to kind of see are similar both in the hospital and in the retail setting. So, you know, a 6 to 2:30 or a 7 to 3:30 or an 8 to 4:30 or a 9 to 5:30. There are a lot of 10:30 to 7, 2:30 to 11 p.m. There are also overnight shifts that a pharmacy technician could have. So, but most of the time, those shifts are going to be specified to the overnight technician who prefers to work that shift and does it all the time. I think in all of my years of pharmacy, I've worked 3 or 4 night shifts, and that was because I offered to do it. It was not mandatory.
And let's see here.
I think I should also mention on that time, on the time schedule, it's also important to note, and we do have a blog post on this you can check out on our website, but important to note that almost all pharmacies are going to have a rotating holiday schedule, right? So most pharmacies are still open on holidays and weekends. So most pharmacy technicians at least work 1 weekend a month. And then you do like a rotating holiday schedule. So generally you're going to work like one major holiday, which is either Thanksgiving or Christmas. And the next year you'll work that other one that you didn't work this year. And then those minor holidays, usually the goal is 2 to 3 of those. So Labor Day, July 4th, New Year's, things like that. But you do have to take into consideration those weekend and holiday hours for pharmacy technicians and really anybody in healthcare as well.
Thanks for mentioning that, because that's really important. Because if you're somebody who I refuse to work any holidays, any weekends, you might want to maybe revisit if this is the field for you. So I'm glad that you brought that up.
Any healthcare field is correct.
Yeah, that's true. So my next question, and then you can speak about this from personal experience. Maybe you've gotten some feedback from your students that have graduated and gone on and got their certificate and licensure and are working. But what would you say are some of the rewarding parts of being a pharmacy technician, those great parts of the job, and then what sometimes are maybe the more difficult or challenging parts that sometimes you can struggle with?
I think some of those things that are good and some of those things that you can struggle with a little bit kind of go hand in hand. So a lot of times you're going to hear people say, I love the place that I work. I love the people that I work with. But at the same time, you're working very close with a group of people, sometimes a small group of people in a very small area. And that can be a lot for people once in a while. And that can really, really take a toll on your attitude here and there. So I think that's important to kind of keep in mind. But really, if you are the type of person who enjoys helping other people and knowing that your work is making a difference and that you're doing important work, I would say that that is one of the biggest benefits of working in healthcare or pharmacy in general. Also, if you enjoy forever changing, growing industries, pharmacy is a great place to be. It is always changing, always growing, always evolving. Pharmacy technicians are growing rapidly and our role is expanding rapidly as the years go on so that the pharmacist has more time to put towards direct patient needs. The pharmacy technician is getting more responsibility, and that's awesome for us. That also means more pay, right? That means more hours available for our position. So those are really great things. So again, that kind of goes hand in hand. If you love being busy and you love doing something new every day and you love to be go, 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 then that's great. If you are not somebody who loves that, then that's going to be a downside for you. But those would be the biggest ones that I would say.
Okay. And then you've mentioned, obviously, the pharmacist is in there with the pharmacy technicians. Let's say I start out as a pharmacy technician, but I want to grow my career. I love working with medications. I love working with the insurance, the patients in that way. What are some things I can grow? How can I grow in my career after I'm starting out as a pharmacy technician if I enjoy that area?
Great. That's a good question. So as I said, in retail pharmacy, you can work up to things like inventory specialist or lead technician or team lead, they sometimes call it. There are other ways to move up in retail pharmacy, like being a district manager or a district supervisor. And a lot of times those are managed by pharmacy technicians. In the hospital setting, I feel like there is a lot more room for growth. Hospital setting, you're going to start out just basic basic tasks in the pharmacy, but then you get to learn med history and chemotherapy and IV. And like I said, I joined the hazmat team, and then I was the supervisor. We had a pharmacy buyer at the hospital. So kind of like that inventory specialist, but she is a full-time position. That specific person does a lot of different work, but it's all managed within that inventory role. So she's completely specialized in that role. And that's something that she's worked years on. And, you know, a lot of the pharmacy department really leans on her to make sure that those things are in there. And that's an important position. Other than that, we have students who have gone on to be chemo data entry technicians. We have students who work in warehouses. We have students who work with NHA, which is who our students take their national exam through. And then, you know, I feel like if you are willing to work hard and you want it to grow, you can really make anything out of it. I turned it into a school. But then past pharmacy technician, keep in mind so I worked directly with pharmacy technicians who were working in pharmacy for a higher goal. So one became a nurse, one became an EMT, one became a respiratory therapist. Pharmacy is a great way to get your foot in the door for any healthcare field, because if you think about it, no matter what healthcare field you're in, they all pertain some sort of medication. So it's a great way to get your foot in the door. And then obviously, if pharmacy is really where you want to stay, going to school to be a pharmacist.
I appreciate that, because I know a lot of times people just think it's the pharmacy tech and the pharmacist, and there's not these other options that are either in between, or some of those I had never even heard of. So I appreciate it. There's definitely a lot of room to grow.
And so, I'm sure I'm missing several. So there is plenty of room to grow.
That is awesome. So you mentioned just now too that one of the things you did after becoming a pharmacy technician, as you grew in your career, you went ahead and started KLR, your own school, to be able to teach others about this field. So specific to your school, I wanted you to take a moment to just kind of explain what could a student expect with their time with you if they're being trained through KLR. What are the classes like, the size of the classes, attendance policy? So if you can just give me like a synopsis of what is it like to do my training through KLR?
Yes. So I love this question. Actually, it's so good for students to know that coming in. So for pharmacy tech, we meet 3 times a week, Monday, Wednesday, and Friday from 9 to noon. And those students meet on Zoom, just like you and I are right now. So they're in the comfort of their own homes, or they're at their school, wherever they're connected to an internet with their computer. And our class size is generally, for pharmacy tech, it is usually anywhere from 30 to 60 students. That varies basically with each term. So for instance, we held a summer session and we only have 12 students. So that's a very small breath of fresh air class. But for most terms, we have 5 terms a year. And for most of those terms, we do have 30 to 60 students. And that is projected to grow this year. But those classes are 8 weeks long. So you meet 3 times a week, 3 hours each time for 8 weeks. And it's really a 7-week course, because in that 8th week, the students take their national exam. So if you can get through less than 2 months and bust it out and work really hard, you're good to go. And I always tell people, like, right, short-term sacrifice for long-term success. So when we are in classes, our classes generally start out with the students log in. We do have a motto here: if you're not 10 minutes early, you're late. So those students are expected to log in 10 minutes prior to class starting. They go ahead and start their classwork. So up on the screen is some math practice, basic pharmacy math, SIG code practice, just other things that we do in class. And they work on those in their classwork notebooks, and they have about 15 to 20 minutes to do that. And then after that, we review those together. From there, we generally will go over a chapter or we will do an oral review, or we will do some sort of participation with students, answer questions, do announcements. A lot of times we have guest speakers who come in from different employers and speak with the students. Our director of administration, Allison Hardy, comes in once a term and talks about resume presentation. She does a professional resumes presentation to help those students make sure that their resumes are on track for employment. So where they're going to put their licensing and their certification numbers, what things are going to look good on a pharmacy technician application, talking about a cover letter, things like that. And then generally at the end of the class, we have work time. So I do try to make sure that this class is a lot of assignments. So I do try to make sure that students have ample time to work in class. That way that they're sitting there right with me and they can ask questions. So usually we try at least the last hour of class to have that work time where students are just working and I'm kind of just here, maybe putting those grades in while they're doing that or working on something else, but they can see me, they can speak up and ask questions, or they can ask their other classmates those questions during that time. That's pretty much how the class goes. Like I said, the 8th week, they go ahead and take their national exam.
Okay. And of course, I'm in St. Louis, you're in Indiana. So like if one of my students takes a class, it will actually be from 8 to 11. So the hours might vary a little bit by where you're at, but it sounds like, you know, that you're there to help, that there's a good amount of time and resources and you're available, but also a student needs to be pretty self-motivated and able to keep up and stay on top of things. So
correct. And if you talk to past students, they will all tell you that the class is not hard, but it is time consuming and it is a commitment. But if you follow the guidelines and you trust me and you go through the process, you're going to be fine and you're going to be prepared.
So you did mention, you mentioned your certification testing in the last week. So sometimes people get confused about certification versus licensure and things like this. So first of all, I was wondering if you could just let us know kind of like what your pass rate is or how well your students are doing on the certification exam, and then explain if a certification is all you need for pharmacy tech. Do you also need a license? What does that look like?
So our pass rate is 100% for the last 2.5 years. We have had 211 students to date pass the national exam for this course. We are incredibly proud of that. So proud of all of our students who have worked so hard to reach their goals and hit that serious accomplishment. That's just so awesome. The licensing, to answer your second question, the licensing and the certification are different. Okay, so you are going to take this course so that you can take your national exam. Your national exam in some states, it is required, okay? In some states, it's not yet required, but almost all employers are going to require it within a year of you getting hired anyways, and then you're gonna have to pay for it on your own instead of study for it on your own. So the national exam is what employers are looking at that says, I'm committed to this role, I know this material, and is going to be what gets you paid higher wages. So they're looking for that. And you almost always get paid higher, $2 to $3 an hour higher for that national certification. Now, if we go back to the licensing, which is almost backwards. So if you think about it, that's almost what you'd want to talk about first, but because you have to get the certification before you get a license in most states, it's not backwards. So if you think about a license, if you're going to go work at a restaurant as a server, you most likely need a liquor license. To get a liquor license, all you have to do is get online, fill out a form, pay $25, and now you have a liquor license. It's basically just a process the government has. And that's usually how I explain it to students. Now, in pharmacy, you have to have a license to do anything in a pharmacy, to work in any pharmacy. Your national certification will not get you a job just by itself. You have to have a state license in the state that you are going to work in. To do that, it is not just as simple as filling out a form and paying $25, but it is almost that simple. So those students are going to go through a background check, a fingerprint process, and pay a fee. And KLR takes care of all of that. So the students will meet with us after they take their national exam and pass it. And we go through that entire process with them, and it is included in our price.
Excellent. And I know sometimes people wonder, with a license, do you have to renew that every so many years? Is there a fee associated with that? And then also, is there any CEUs, continuing education units, that a pharmacy technician would need to get every year?
Very good question. So for your national exam is what always people freak out about. So let's point out, first of all, your national exam is what requires the exam, the test. Your licensing requires no test. It's just a background check and a fee and your fingerprints. That's all. Now, for both of them, you have to renew. Your licensing, which does not require any sort of exam, is renewed every 2 years. Okay. I believe it's every 2 years for every single state. That's what we've come across so far. It's usually a certain day. I know for Indiana, it's June 30th on even numbered years. Every technician has to expire, or every technician's license expires on June 30th of even numbered years in Indiana. In order to renew your license, you don't have to go through a background check again. You don't have to get your fingerprints again. You don't have to blah, blah, blah. You just get online and pay $50. That's it. You're done. Done for 2 more years. Again, just another government process. Now, for your certification, which is what we take our exam for, right? That's what you're taking the course for. Your certification is a little different. In order to renew your certification and keep that certification for 2 more years, you have to prove that you have gone through continuing education, or CE, like you just said. And that process is very simple. We do meet with our students during our course to talk about that process. And we do have all that information on our website so that students can click directly on it. There's a step-by-step walkthrough process. You can find most CEs online for free. So you have 2 years and you're going to earn 20 hours of continuing education, which is just 10 credits. And it is mostly, you can find these online, where it's going to pop up a document that you read about a certain subject, and then you're going to take a quiz on it, and then you're going to upload it to your NHA, and they're going to say, okay, now you have 2. You need this many more. So that process is very simple. And then you do pay a fee at the end of that. I believe that is also $55. And that's every 2 years. And that your certification expires 2 years after the date that you took your exam.
And I know that a lot of times employers too, with those continuing education units, they're going to have something available. You obviously said you have information on your webpage, you're prepping people before they even graduate. But if somebody's a KLR graduate and they need more assistance, or just having a hard time figuring out, can they communicate back with the school to get information about continuing education?
I have students reach out to me who were in this class 3 and 4 years ago now, all the time. And we do meet with them. They'll message me on Facebook, they text message, they call, they email. So they have plenty of ways to continue to stay in touch with us throughout their career after they finish and graduate from our program. And yes, what you said about the employers, a lot of times once you go get a job in pharmacy, your pharmacy job is going to have modules that you have to do every year as an employee. And a lot of those transfer over to CEs.
Right. I like it. We can kill 2 birds with 1 stone, right? That's always a good thing. So kind of my last question is just kind of a catch-all of who can be a pharmacy technician. And in particular, there are 2 topics I kind of wanted you to touch on with this. One is, some people have a past and they have a criminal record. It happens, right? And then of course, nowadays we have concerns about the COVID-19 vaccine. So in particular, who could be a pharmacy technician? And those 2 barriers, are there other barriers out there that would prevent somebody from pursuing this as a career path?
Very good question. That question is a broad question, so you're going to have to kind of bear with me here. It does vary quite a bit state to state. So as far as the background check goes, you do have to have a background check in any state to get your licensing and be a pharmacy technician. A lot of times what we found is Missouri, Indiana, Tennessee have been very simple to go about that process. California has about 7,000 different requirements you have to go through, and so does Louisiana. So it just differs state to state. But a lot of times those if you have a background, it does not automatically disqualify you from becoming a pharmacy technician. A lot of times, if you have been arrested, if you have a background history at all, they are going to ask that you provide a positive response documentation, which means that you write a letter saying the exact dates of what happened, explaining what happened, what you learned from it, what the consequence was. So were you on probation? Did you spend 6 months in prison? Did you have to do community service? Did you have to pay a fee? And then the date on which your trouble was over. When was it done? So we help the students write up that document. And then in addition, the students need documentation, court documentation. So the students need to submit documentation to us at the beginning of the course for that. We have them submit all of that at the beginning so that we're ready for it on week 8. And the majority of the time, the process is very easy. We simply submit those documents, the Board of Pharmacy reads over them, and you're good to go. If it's something a little deeper, right? If you're going to be working with medications. So if you have a past with drugs, specifically heroin, meth, things like that, the Board of Pharmacy may want you to go in front of the board and speak with them. They may want additional documentation. And that is just a case-by-case situation that I can't give too much information on because it is just so different per person, but still does not automatically disqualify you from becoming a pharmacy technician. But those drugs and theft are going to be the ones that are a little harder to get around. We're going to have to work a little harder for them because, you're going to go work with medications and they want to make sure that they can trust you. So those are big ones. As far as the vaccine goes, again, that's a broad question and it just it varies from place to place. So some hospitals are saying yes, some hospitals are saying it's up to the employee. A lot of retail pharmacies like CVS and Walgreens have either said yes or said yes at first and are now saying, no, you don't have to have it. So that is going to be something that is, again, case by case and state by state. However, if you are considering working in pharmacy or any healthcare, it's important to keep in mind that if you are someone who is against the vaccine, you can probably find a job, but you're going to be a lot more limited. It's going to be harder for you to find a job. You are not going to be able to get a job at a lot of these larger hospitals who are definitely going to be requiring the vaccine for the unforeseeable future.
Well, so it sounds like really if somebody's willing to work hard, stay on top of things, stay dedicated, ask questions, it sounds like they can be successful in this field. And I just want to say real quick, I appreciate the honesty with which you answered questions because knowledge is power, right? So, and nobody wants to get into a training program and not know what they're getting into, or they want to know how to maybe some barriers I have factor into that career field. So this has been super helpful information on pharmacy tech. So I appreciate that, but we're not quite done. There's more. I'm very excited about this. Very excited. Very excited. As a college career planner, you guys have brought on a new career that you're helping to train for. It is the CBCS medical billing and coding. So I'm going to ask you some of the similar questions to that. So the first thing I'm going to ask you is just to kind of briefly explain what a medical billing and coding specialist or professional would do.
Okay. So that is, I keep saying this, but that's again, kind of a broad question. So medical coding and billing is going to be, you are normally working in either a hospital, in the back end of a hospital, or in a doctor's office. So these medical coder and billers, coding is different than billing. And sometimes these jobs are combined and they're together. You're going to be doing billing and coding. A lot of times though, they are very separate. So you're going to specialize either in billing or in coding eventually. So obviously medical billing is going to be more the insurance. You're billing those patients for the insurance. You're speaking with patients and making sure that you have all the information, and you're working with insurance companies and making sure that the revenue cycle for the hospital or the physician or the employer that you're working for is running smoothly, right? The revenue cycle is how we get paid. The coders, so medical coding is a very interesting, very, very interesting position, and is very, very detailed. So those medical coders are taking codes that they're already set up codes, and they are connecting those codes with diseases, supplies, procedures, surgeries, things like that. And that's how they're billed. So you see how it all goes hand in hand. It's coding and billing. So we're going to code it and then it's going to get billed. So as a medical coder and biller, you definitely need to have knowledge on both topics, if that helps.
Yeah. And again, it definitely sounds like being detail oriented would be helpful as a medical biller and coder, whether you're doing kind of one end of the spectrum a little bit more than the other, or a combo job. What are some other personality traits or skill sets that you think would be particularly helpful to somebody going into this field?
The detail to orientation, I would say, would be the largest one. Communication skills, again, I don't think there's any career field you can go into, healthcare wise or not, that isn't going to require you to have great communication skills. You're going to be communicating again with patients, with other members of your team, with insurance companies. That's really important, right? It's like the telephone game when we're little. If you don't say the right thing, or you mix it up a little bit and the next person mixes it up a little bit and the next person, all of a sudden we have something we have no clue what we're talking about. So communication is really, really important, especially in healthcare. Working well with a team. You're still working with a team. So that's important. Accountability, knowing that this is what I need to get done today. This is my position. And if I don't do these things, so and so is left behind. They have more work on their back. And same thing with pharmacy. I think that might have been one that we should have mentioned there too. But keeping in mind that you're part of a team, that team-oriented atmosphere, things we can't teach, right? They just kind of come to you. And you can learn to do better at those, but those are all really important things, I would say, for a medical coder and biller. Honesty, you know, we have to be billing and coding correct things so that we're not getting charged with fraud. So things like that are going to be really important.
And I know we've all had hospital bills before too. And so we know if we get things and they're wrong, it can even be frustrating as the patient. So it's really important to have people out there that are doing that correct. It sounds like it's definitely a trickle down effect for not just the medical facilities and providers, but the patients too. You can make a big difference.
And for that reason, exactly what you just said, that empathy and compassion goes right there in that, right? Like when someone's been hospitalized unexpectedly or expectedly, and they receive a bill for thousands and thousands of dollars, we have to remember on our end why they're calling and they're so frustrated and why they're so upset. You know, something like that can really, really hurt your finances. Not very many people have thousands upon thousands of dollars sitting around to just pay a medical bill. So I think that empathy and compassion for your patients is really important as well.
Yes, definitely. And we kind of talked about this with pharmacy tech. We talked about the physical demands of pharmacy tech. There's a lot of maybe standing or walking depending on where you're working. What are the physical demands for medical billing and coding?
A medical coder and biller, I would say it's very much sitting at a computer. So if you enjoy spending your day at a desk or a computer in front of a computer screen, I would say the only physical demand on that would be just your eyesight. We all know that looking at the computer all day isn't the greatest thing for us, but it's a lot of desk work.
Okay. And we also know nowadays, I actually have this on these are prescription glasses, but you can, whether you have prescription glasses or you're doing just regular blue vision, I guess I call them blue vision glasses for blue light, you can get glasses that can also help protect your eyes as you go through a career where you're working a lot on the computer too. So that's always a good option. So what are the kind of places that you can work, maybe the kind of hours you can expect? I would assume this job is more regular hours than a pharmacy tech, but maybe it's not. What could you tell us about that?
It is more regular hours. So a lot of the jobs that you are going to find as a medical coder and biller or medical coding or medical biller are going to be in hospital or in doctor's offices. So, right. So you're not just coding anything and everything. There are millions and millions and millions of codes, right? You're never going to remember all those. You're never going to be able to figure that all out. No one's going to be able to do that. But usually if you are working, say, in an orthopedic clinic, you are using codes specifically for feet, right? So, but those, again, those clinics you're not going to find a foot clinic that's open at 11 o'clock at night. You're typically not going to find a foot clinic that's open on the weekend. So those are usually going to be positions that you're going to find more of your 8 to 4, 9 to 5, things like that.
And I really should want to mention this because it probably could apply to pharmacy tech. It definitely obviously applies to medical billing and coding. And I wanted to make sure I mentioned this specifically a little bit more before we move forward. Working on a computer. Now we know that pharmacy techs are going to use the computer as well. Obviously medical billing coding, you're on it 24/7. What would you say about somebody coming in if they don't know, if they're just a hunt and peck typer, they're not used to doing it like we see in the movies, or somebody that's been doing office work for a long time, or maybe they're a little afraid of a computer. They're just not super computer savvy. Can you speak a little bit more about experience with technology for coding first, and then also for pharmacy tech?
Yep. So for coding, I would say you probably need to have a little bit more knowledge on the computer just because you are going to be using it a lot more. But again, it's going to be, no matter where you go, that's going to be a system specific to your employer. So just like if you go work at a fast food restaurant, they have their own system that you're still going to learn. No matter how good you are at computers or cash registers, they still have their own system and you're going to have to learn that. And most employers are going to recognize like, hey, we need to be able to do this. Now, if you're going to try to move up as a medical coder and biller and you're going to take some of these higher on positions, you might need to know how to use Excel and things like that. As far as pharmacy goes, and I would say billing and coding, being able to utilize your email is important, or an email, probably a work email. But pharmacy technicians don't use the computer nearly as much. We do use the computer. And again, that is a very pharmacy employer specific program that you are going to be using, and you're going to be fully trained on that. So I don't think that there's too much you would need to worry about if you're not computer savvy. You need to know how to turn a computer on. And I don't think you need to know how to have great typing skills. I think if you can use a keyboard, you're probably going to be fine. And like anything, the more you do it, the quicker you're going to become at it.
Absolutely. So definitely you don't have to be afraid of either one of these jobs if you're not a computer whiz.
Definitely.
I mean, on top of that too, especially if you're an Excel Center student or even just somebody out in the public, you can definitely go into some free programs. There's even stuff free online that you can look up to help with your typing speed and things like that. So, but I'm glad also that you mentioned Excel. If you're going to move up, might be good if you're a coder or just knowing how to operate an email, because if you're not familiar with it, why would you know? So those are good things to know as a student, that you want to be a little bit more prepared when you get ready to start in this field and then the training.
Absolutely.
So appreciate that. So you spoke about this with pharmacy tech. I was going to ask you this too. What are some of the best things about being a coder and a biller? What are some of the challenges?
Again, I think that just goes so hand in hand with both of them. It's going to be either you prefer this or you don't. Again, with billing and coding, it is changing. The codes are updated each year. So that's a big one. Insurance is always changing. Insurance is literally always evolving and changing. And there are new insurance companies and new insurance policies and new government policies and new laws and regulations, all things that are going to play hand in hand with that. So again, if you love everlasting change and growing and learning and, really evolving in that way, then that's going to be a benefit for you. If not, then no. I would also definitely say that if you are someone who wants to be up and moving and running around, right? Pharmacy is going to be really great for you for that. You're going to be moving all day long. If you are someone who gets too antsy and does not want to sit down all day at a desk, coding and billing might not be for you. So I would say those are probably the two biggest ones that I would think of for billing and coding.
Okay. And then I wanted to learn more about what are career options for me. If I just get entry level, I'm starting as a medical biller and coder. How can I move up? What can I do?
So this one is something we are on, I'm going to be very honest, still learning about, and there's a lot to learn in this area regarding this subject. So we teach the CBCS course, which is Certified Billing and Coding Specialist, and the NHA, the National Health Career Association, offers that exam. And the CBCS is going to be attracted to employers in the insurance industry. Okay, so it's a lot of insurance that you're testing over. But that's a great way to get your foot in the door still. After CBCS, there are things like CPC, CCA. Those are super different certifications that are applied across multiple settings. And they help you grow. There's the MHIT. There are like 12 different certifications. That's what I actually love about the CBCS, is that we will offer another course for this eventually to help students grow in their career and take yet another exam, and increase their wages and increase their titles. We are probably a year or two away from that currently, but really looking forward to it. But there are about 1 million ways to move up as a biller and coder. It is insane. We just actually met with someone who is now a coding director at a hospital, or the coding manager at a hospital, a very large hospital here in Indiana. And she has 3 or 4 different certifications and has been doing this for like 20 years and doesn't seem like she's ever gotten bored. So I think that there are multiple options. I would say also keep in mind, if you couldn't find a job right out of getting your certification as a biller or a coder, these things all go hand in hand with patient registration and patient access and things like that. So your ultimate goal is to get in the door at a hospital or a doctor's office and get that firsthand experience, learn their system, get to know your coworkers, and make a good name for yourself, and then move up from there.
I appreciate you putting out the transferable skill sets that you can do if you couldn't find that medical billing or coding job right away. That's really important to know some of your other options. So I appreciate that. Now we talked about pharmacy tech, there's a certification and there's a licensure. And then we talked about how you have to keep those things updated on a regular basis, but it's a pretty simple process to do so. What can you tell us about certification, testing, and licensure as far as it comes to medical billing and coding?
That it's way easier. So for the Certified Billing and Coding Specialist, the CBCS, there is no licensing required. So you do not need a state license, which requires that background check and things like that. Now, keep in mind, any hospital or doctor's office that you go work for is still going to background check you, right? So ultimately, you're still going to get that, but you can still get the certification without that. And that's just another step in the process once you are looking for employment. If you have a background that you're going to need to explain to your employer in the HR department there. But all that a CBCS needs is their certification. And that certification, again, is good for 2 years. And every 2 years, we're going to renew that. It is $55. Again, very simple. It's even more simple because, as I said, NHA, which is the National Health Career Association, is the one that we go through to take this CBCS exam. And right on their website, as soon as you pass your exam, up pops an entire list of continuing education credits that are free, and you complete them. It takes no more than 30 minutes to complete one. Take the quiz and it automatically uploads it for you. And once you have completed all of them within that 2-year mark, you're good to go.
And kind of my last question here, and then we'll wrap up by just giving you some free time if you would just want to share some information just in general about either one of these career pathways. And I specifically wanted you to mention more about if somebody was interested in KLR and getting training through you, how they would go about doing that. But we talked about possible barriers, who could be a pharmacy technician. Pretty open. There's some barriers we want to be aware of, or limits that we want to be aware of with criminal record, vaccine. Is that about the same with a medical billing and coding? It kind of just depends on your state. If you've got something on a record, let us help you. Is that about the same? And then it's just anybody's willing to do the work and learn the material?
I would say that it is about the same. Again, for that CBCS certification, you don't need to have a license. So that's not a process you have to go through to get your certification, right? You're still going to get a certification. But like I mentioned, with my last response was you're still going to have a background check with any employer that hires you, right? So that's important to know. And again, you're still working in a healthcare field. You're still working in a doctor's office or a hospital. So again, that's going to vary state by state and where you go, how big the hospital is, and what their regulations and requirements are there, and whether or not you're going to have to get that vaccine. So again, like I said, with pharmacy, it's important to know that you probably can find a job without getting the vaccine, but you might be a little more limited, and it might be a good idea for you to reconsider that if you are hoping to stay in the medical field and work in a larger area.
And I know we didn't mention this, I think because it's just kind of a given that people know to expect this, but depending on your employer in either one of these careers, drug testing is something that somebody's probably going to have to go through.
Gonna get a drug
I just know, I work in Missouri, but I live in Illinois. I'm right on the line. And even in Illinois, marijuana is now legalized. But when you go to an employer, if they have their own rules, or even if they receive federal funding, because federally it's not legalized,
Yes.
you still have to do the drug testing and pass it. So it's probably good that we just throw that out there, because I know a lot of people do that just recreationally and things like that, but that doesn't mean that will fly when it comes to your career.
And pretty much any healthcare field is not going to want you to take a drug test with marijuana in your system. There's not. That's pretty much all that there is to it. Again, if you're taking prescription medications, you have to tell them that before you even get your drug test. So you have to prove that you are prescribed those medications if they're in your system. So I do think that's a really good thought to have, and good thing to mention is the drug testing. And if you are someone who is smoking marijuana recreationally, you're probably going to need to consider not doing that, because even once you are employed in a pharmacy or a healthcare setting, there are random drug screens. So that's just something that I think you need to take into consideration and know, like, hey, I'm going into this very respectable field to further my career and improve my life. And this is a step that is probably going to be mandatory for me to take.
Yeah, so I'm glad we mentioned that, because I always forget about that, because just think, oh yeah, we're assuming we're going to have drug testing, but sometimes we don't think about it, or you hear what other peers say, oh, they won't test you, or they don't care about marijuana. And at the end of the day, the fact of the matter is, you need to be clean if you're working in these fields. If that's something you're struggling with and you want to go in these fields, reaching out for help, getting a community resource, or if you're at an Excel center, getting with a college career or personal life coach can definitely help deal with that, so you can keep moving on and pursue these careers if you want to. So I appreciate the time today. Tons of information. It was helpful for me. I knew some of that, but there's a lot I didn't. And I guess before we wrap, I just want to mention too, you mentioned how the classes work for pharmacy tech with the terms. It's online. Is it pretty much the same format for the CBCS?
It is exactly the same. So these classes are fully online, so we can serve anybody in any state. We meet 3 times a week, and that is usually a 1 to 4 p.m. Eastern time. So for you in Missouri, you're going to be 12 to 3. And that's going to differ for Arizona's 3 hours ahead of us. So things like that. But they are also 8-week classes, and during the 8th week, the students do take that national exam.
I appreciate that. I want to make sure I clarified on that. So about the same format, but maybe in the afternoons a little bit more. So, well, like I said, I learned a ton. I very much appreciate the time. I know we've had some students go through the Excel Center here in St. Louis, and they have had nothing but wonderful things to say. The biggest thing to me as a college career person is they're actually prepared for their career. They're prepared for the certification testing too, because sometimes that can be a little tricky, right? But they feel confident. They feel like they had time to learn and that questions were answered. So I just really appreciate you and what you've done for them and what you're doing for everybody else at the Excel Centers and across the nation. These are definitely needed jobs. And the great thing is it allows somebody to have independence and to move up and have the money they want for themselves and their kiddos and their kiddos. So it's definitely great to learn more about those. So just before we close, I just wanted to know if you could share a little bit more, if you have anything else to say that you want to share about these careers, and then specifically talk a little bit more about KLR and if, hey man, I'm interested, I think I might want to do this. How do I go about getting connected?
So getting connected is super easy. If you're an Excel Center student, you need to reach out to your coach, your life coach, your director, any of your instructors, all have our information, and I am in constant contact with all of them. And those people will easily just send me your information. You guys at the Excel Center have such an advantage. Like I said, I am an Excel Center student, so I have so much passion for what the Excel Center is and is doing. And you guys are just being given such a great opportunity to take these certification courses. I love that it's part of the graduation process. It is so cool. So Excel Center students are a little easier. If you are a public student, you are simply going to reach out to us. You can email us. You can find us online at www.klrfarmtech.com. And there is a section on there to either register. You can pay online with credit card or debit card, or you can go about using a payment plan. And to do that, you would reach out to us and I would set you up with our Director of Administration, Allison Hardy, who handles all of that and is great about setting those payment plans up. And that's pretty much as easy as it is. So we do teach for, we had 11 different states, but we don't have any state yet that we haven't said, no, we can't teach this course for you. So it is a little, we do have to look into the state requirements. Some of the state requirements are different, so we have to make sure that we know those. But currently right now we are offering to anyone that reaches out.
It's cool to hear about you growing 11 states already. That's pretty good. Maybe we'll see you on a billboard one day. You just never know.
Well, we've got a great staff building up too, so it's really exciting. And these students really kind of make all of it possible. They are the ones that are really doing the hard work. I always tell them that they're putting forth the hard work and they're sacrificing their time for 7 or 8 weeks and really making all this possible. We are so, so proud of them and so thankful for the Excel Center and our partnership with you guys as well.
Well, we definitely appreciate it. I appreciate your time today. I know you're busy. I will let you go. So again, if you're interested in KLR, follow up on that information that Katie gave you. If you're an Excel Center student, life coaches, teachers, skill up person, it doesn't matter, your CCR, we can definitely get you hooked up. So Katie, again, thank you for the time today. I appreciate it.
Thank you so much. Take care.
All right, bye-bye.